family planning is a key component of reproductive health and therefore very key in the interventions that we have as Amref country office in Uganda. As Amref, our vision is to empower the communities to appreciate what family planning is, its importance, and how it can actually enable the communities to thrive the way they should.
One thing that we are now looking at is advocacy in health, and we are really looking at supporting government in regards to following up on these international commitments, health international commitments.
There is a lot that the government has done, specifically in Uganda, with the support of development partners and also the implementing partners. In Amref, we have done a lot of work and we will continue to do that kind of work in terms of system strengthening, health system strengthening. So what do we mean by this? We build the capacity where it's not, and we strengthen where it is low, capacity of health workers to deliver quality services. In this case, family planning is one of them. We also support the health facilities in terms of creating that good working environment to provide quality family planning services, among others. But with that said, we need to sustain the gains, but also step up our game.
This project is focusing on advocacy for two building blocks for the health system, that is human resources for health and health commodities. And in health commodities, we're specifically focusing on sexual reproductive health commodities. Amref has a larger program on reproductive, maternal, newborn and child health. We have projects going on, especially in northern Uganda, in central Uganda, in Chankwanzi, and other areas. We also have a program on e-learning, which is skilling midwives, enabling them to upgrade and perform better on their roles. This advocacy project is coming to complement the work that is already being done. There is a very low uptake for family planning services in Uganda in general, and this is probably related to the social-cultural perceptions around family planning. So for starters, we are working with community-based organizations in 6 districts, that is Lira, Dokolo, Soroti, Serere, Kabale and Kisoro, to engage the local population, the community members who are the actual consumers of family planning services, to do service monitoring in their health centers to determine how accessible and available these family planning commodities are. Then we are also working through our national level partners like White Ribbon Alliance, who in conjunction with the district level based, community-based organizations are organizing citizens hearings where citizens interact with service providers, the duty bearers in the districts, and let them know the challenges and gaps that they are having relating to access to family planning commodities and general SRH services and commodities. We hope that this would will in turn trickle into more knowledge about the gaps that they are there in accessing family planning commodities and services, so that as the districts are planning, they are able to factor those needs of the people that they have reflected.
we are not doing this in isolation. As Amref, we know that there are other players out there in the communities where we work in, and not only the locally based stakeholders, but also nationally based and other implementing partners. So we have stakeholders in health service delivery at different levels. Government is the #1 stakeholder. District level, you're talking about the district health teams. At national level, you're talking about the Ministry of Health. We have other implementing partners, the CSOs or NGOs. We have the private sector, which is very important. We appreciate that probably more than half of Ugandans actually access their services from the private sector. So if we want to strengthen particularly family planning service delivery, we cannot ignore the private sector. They have a big contribution. So in our work as Amref, we establish these networks, we establish these partnerships wherever we are present, so that we bring in the synergies, we strengthen our contribution together, and collaboratively, I think we achieve more.
And we also have our technical teams sit at different technical working groups that are really patroned by government or different sectors, and there we use those forums to share knowledge, also to receive knowledge and to learn best practices. We are very free at sharing knowledge. We share knowledge, and we always want to see these modules that we've started being scaled up. We hope that at the end of the day, when someone looks back, we want them to say Amref has contributed to the health in this country. But we also want them to say we are able to sustain ourselves.